I used to do the hooker book at the Armory back in the day when we had teenage hops there. But Flint is losing that beautification. That used to be our motto, just like Boy Scout, be prepared. But it seemed like outsiders are dictating to we that live in the city. So I beg of you, my brothers and sisters, reconsider that piece of property to be something beautiful. I heard Sister Taylor gave some suggestions. Maybe it's a park, could be. But if I stayed overnight at that hotel and then wake up the next morning and hear and see and smell a recycling or whatever dump or junkyard, that's poor beautification. Thank you.
Thank you. Do we have additional public address? Additional public address. Third time. Public address is closed. Under the reports of standing committees, we have Board of Commissioners. I'll entertain a motion to put this on the floor so that we can have discussion and hear from some of the folks in the audience about what's been worked on since last week.
So move it.
Moved and supported. There is discussion. Why don't we start with Captain Kennemer, and is Crystal here? If you maybe both would approach. I know that you and Derek, I don't know if you've had involvement since last week or not in this topic, but this is the food vendor at the jail issue, if I may describe it that way. And I'll let you all share some information about what's occurred, and then we'll have questions, I'm sure.
First of all, I want to thank the board for the direction they gave last week and postponing it and putting us back to the negotiating table. Through tough negotiations with TIGS, Canteen, they did come up with some creative solutions to lower the cost or their proposal by 20 cents. So it would be approximately $1.70 a tray based on our head count today. And Crystal took that, and her and her team came up with an evaluation based on all the proposals that were received. I know that she presented each one of you that as well. I also was sent an email with some additional information to all the commissioners. I hope you had a chance to review some of the documentation I sent regarding the litigations of all the companies that submitted.
All right. Crystal, do you want to add anything?
The phone calls that I received this week were, if we decide to go with one of these other vendors, how are we going to fit that into the budget? And the discussion I had was, we'll have to figure out, are we taking something out that is a nice to have to add that? Or, we do the quarterly sweeps of vacancy savings. Is that something you want to commit a portion of for this instead of the capital projects? There's a couple ways we could do it if this is something that you truly want to pass. But as of right now, it's not something that we can just add to their budget and move forward.
Okay. I'll open it up for questions or discussion on the motion. Commissioner Shoemaker.
Thank you, Mr. Chair. So let's just start so we have a basic set of numbers. Earmark is, as far as the first year, is just under $1 million. What was our previous year before with them, our spend?
I don't have that.
I don't know that my answer.
But we have an increase, correct? Even in their number?
Yes.
I think it would be yes.
If I'm remembering correctly, it was, I want to say it was fairly significant, but not a ton. So when we see these numbers on here, obviously we're saying more than Aramark with their increase. Obviously, these are the baselines that we have to work with. I understand the case that the Sheriff's Department and the jail administration have brought. And like I said, I appreciate Canteen working with us, but my big question is, where are you going to get the funds? I've had poor Crystal's been on the phone with me more than she probably like, because I do take this very seriously, and I know everybody gets tired of me saying this, but eventually the coffers run dry. You can't do every program. You can't. We gave 1.5 million to a group a while back, and I made the statement that, guess what? We didn't plan on it, but you just did it, and eventually you're gonna need these funds. This is the type of thing, we are responsible for operating this jail. It's one of our statutory duties. Now, at what level? That's for us to decide. But it's a large increase. So we gotta decide now whether we can take it out of their budget or you're gonna come up with it someplace else. But as I said the week before, we have our wage increase for all of our staff. And we know that was around 1.3 we're figuring for next year, right around there. Crystal handed us that nice colorful flyer that showed we're only gonna increase by about $260,000 as far as what she knows so far. Now, she did state that there's more money that could come from the state as far as revenue sharing. But we can't depend on that. We also can't depend that, guess what, we're gonna get the $3 million annually for the prosecutor's office. And I'm pretty sure we're not gonna cut those jobs, so we gotta come up with those funds. So, we've gotta make some tough decisions. Like I said, I appreciate them working with us. I think it was a great attempt on their behalf, and I really do appreciate our staff working on it, but to this board, that's why I'm glad to start out. Where do we suggest we get the funds from? Thank you, Mr. Chair.
You're welcome. Do we have additional, Dr. Brown?
Thank you, Mr. Chair. So I had a chance to have a conversation today with Captain Kinnemer, and so I wanted to ask you, so the other commissioners can hear the response to one of the questions that I asked. And man, I lost my train of thought of what the question was. But I think it had to do with, well, first of all, to send me photographs of the food that actually Aramark was serving. And then the other question, I know what it was. How many times have we approached Aramark about making improvements to their standards? And what was their response?
So that was a great question, a ton of times. As a matter of fact, part of our correction action plan was to meet with the local leadership on a weekly and bi-weekly basis. It was the product that we were getting and the service that we were getting was bad enough that we had multiple meetings with the president of Aramark Correctional Division, the multiple VPs. We had on-ground meetings with the VPs from Aramark to set up the correction action plan and to address the issue of the quality and quantity and the product that they were producing.
Okay, and I did have a chance to share the photographs that you sent me with a couple of other commissioners, and first of all, if they have not been able to raise their standards after having those conversations and having those weekly meetings, then I have a big problem with that. I also, you also shared a situation that, well, let me switch over to Crystal. So I had a conversation with Crystal too, and asked Crystal, where could we find the money? That's the question that Commissioner Shoemaker just asked. Where could we find the money? And can you share with the rest of the board some of the options that you proposed?
So, as I mentioned earlier, we could take something else out that's not a mandated item within the sheriff's office to help cover that. We have the quarterly vacancy sweeps out of general fund. If we have vacant positions for that quarter, we sweep that to the capital project fund. That's helped fund some of those capital needs. The third option is you could decide to use fund balance. But you know, bond rating agencies and when you're looking at metrics for fund balance, you don't want to be dipping into that for operational costs. That's more of one-time, you know, capital items or things like that. It's similar to your savings account at home. You wouldn't want to keep dipping into your savings because you've went out and got yourself some more bills to pay every month. That's money you have set aside for one-time, hopefully one-time either emergencies or items that you prefer to buy. So those are the options that, you know, if you truly want to move forward, we'll have to figure out how to make one of those work.
Okay. I'm gonna be voting in favor of this, resolution because the food that I saw was substandard. We can't tolerate that anymore. I'm not saying that we should be serving our inmates, prime rib or anything like that, but we can do much better, and we should do much better, because I had a conversation with Commissioner Flewellen earlier today, and, we talked about the duty that we have as a policymaking board to care for the health and the nutrition of the inmates that are housed over there. And so, I think we need to really just make some hard, bold decisions about what things we have to give up in order to improve the quality of the food in the jail. And so I'm prepared to look at capital needs. I'm prepared to look at non-essential programs. I'm prepared to look at raises. Anything that we can do, and any programming that's out there, anything that we can do to help avoid taking dollars from the general fund. So, thank you, Mr. Chair.
You're welcome. Do we have additional discussion? Commissioner Cousineau? No? Yes?
I'm waiting till everybody else.
Okay. Commissioner Flewelling.
Thank you, Mr. Chair. Crystal, do you maybe have an average amount of how much that vacancy sweep is?
It just depends on the quarter and how many vacancies the departments have. The first quarter of this year, I think, was about 560,000. The second quarter, I think, was about 270,000.
And moving that to capital projects, that's not statutory, that's just our choice?
Correct.
Okay, okay.
It's just helped us pick off some of those smaller capital projects that, don't require bonding or a huge amount of
Right.
a commitment. So we've been picking off the smaller things
Sure.
with that. But yeah, that's not mandatory that we
And
do
for the
that.
most part, a lot of those capital projects are our choice, right?
Yes.
Yeah, so, okay, so, I guess what I can say is, and I've had a chance to talk to a couple of my colleagues today, I don't, this is gonna sound horrible, but it is what it is. I generally don't have a great deal of empathy for someone that winds up in the jail. Innocent until proven guilty, I understand all that. However, that being said, once we arrest individuals and house them, lodge them in our jail, we are responsible for their care. We are responsible that they walk out of that jail in just as good a health as they walked in, right? We're also responsible to our employees. We're responsible to ensure inmate safety and employee safety, correct? I know that there's studies out there that have shown that nationwide there's been riots in correctional facilities over food quality. Now, Captain Kennemer, without putting you on the spot to say something you can't, have you experienced over your career issues in the jail over food quality? Nothing specific, but just, have you experienced issues over this?
Yes, as recently as yesterday and today.
Okay. Okay. Now, looking at this sheet, obviously, Canteen, you guys did great work over the past week. They're not the lowest price, right? But at the same time, lowest bid's not always necessarily the best bid. And so, if we have the 5 votes to pass it, I hope we do our due diligence and work hard to figure out how we're gonna pay for it. Thank you.
You're welcome. Commissioner Getzinger.
I also feel we really don't have we have to take care of our staff and our inmates, and we have to find someplace else to pay for it.
Additional discussion. Commissioner Cousineau.
Well, I was really kind of hoping everybody would speak before me, but it's really hard for me to speak, This is, I agree that once we take them in, we're responsible, and we have to provide for them. That's a given, and it is part of the core of what we have to do as a county. So therefore, it has to be done. Now, where do we get the money from? I'm not for taking the money out of the general fund. The general fund is, as stated by other people more eloquently than what I am saying right now, is for other things. Once we set a budget for the county, I try to, as a finance chair, keep it within, if there's increases for something within a department, I try to, in talking, I mean, Crystal does the majority of the work. I shouldn't say I, but, you know, I try to make sure that it stays within that budget rather than taking it from another department. And so if we have to do it, and we do need to do it, I know that there's some things that is non-core related that would be within the realm of the sheriff's department. I think that we should make that decision out of that area moving forward. Mr. Shoemaker is very correct in what he's saying, and we have to make some tough decisions. And him and I both, you know, with different ways of tackling it, have been saying it for a long time. There's gonna have to be made, we're gonna have to make some tough decisions. There's just no two ways to go about it. And I've been in this position, and, you know, and Shoemaker will probably know a little bit about what I'm talking about, but it goes back before any of my fellow colleagues have been here. But I've been in the position where it was almost forced upon me as the finance chair to make that decision. And my colleagues, I'm talking about being burnt by my own colleagues in the past, hiding behind that. And that's why I'm sitting here waiting for you guys to talk, you guys to figure it out. It's not my decision. It's the board's decision. And so we're gonna have to hash it out. Where are we gonna take it from? And guidance, you know, Crystal has the budget down better than the back of her hand. And so we're gonna have to cut somewhere. I know that the sheriff has also been after some increases in some different areas, and after what we had to do with keeping the prosecutors under, you know what I'm talking about with the underfunding of the loss of the funds from the state. Hopefully just on a temporary basis, but we won't know the answer to that until July, one way or the other. And so this is a decision that we have to make. I'd like to make it tonight instead of tabling it. And we need to hash it out. Where do you guys want to take it? We're going to have to take it from somewhere. What does this board want to do? I mean, I can make that decision, but it's not mine to make. I know how I'm going to vote, but I don't know how 5 of you are going to vote. And I want to, I guess what I'm doing right now is I'm saying, I'm pushing you. For the sake of making a decision, make a decision tonight. Let's talk about it. Where do you want to take it from?
Commissioner Flewelly.
Thank you, Mr. Chair. Crystal, microphone. Oh, I'm sorry. I'm not loud enough. Crystal, I'm looking at this, the first year of canteen is $1.169 million, right?
Yes,
And that would start June, or July 1st?
July 1st.
July 1st through September 30th is the cost we're looking at right now, right?
That would be for the period of July 1st through June 30th of the first year.
Right, but what we're discussing right now, I think, is how we pay for it for the remainder of the fiscal year, correct?
Yes, and into the next year's budget.
Right, yeah, we gotta build it into next year's budget. Do you know what the increase is between Aramark right now and that first year of, I think somebody already asked that, but I'm just looking to see how much we gotta make up before July 1st, if we go with
So
this.
the budget amendment that's attached in Legistar was based on the original, and that was almost 80,000 for the rest of this fiscal year, so it would be under that, but I didn't recalculate that number.
So to pay for canteen, let me make sure I got this right. To pay for canteen for the rest of the fiscal year would be $80,000 high end.
Yeah, it would be less than that. That was based on
Okay.
the middle best and final offer, not the new best and final. So it would be under 80,000. And
Okay.
we could even sweep back, we transferred that 260 for the vacancies, we can transfer back that 80,000
That was gonna be the
or
next thing I
less,
asked.
if that's what you
Yeah.
wanted to do.
So we haven't, you said 260 or 560 the first quarter?
The first quarter was 560,000,
Okay, and we've just allocated it, we haven't spent it?
correct.
Okay. Okay. So, Mr. Chair, can I amend the motion?
You may.
I'd like to amend the motion to approve Resolution 2026-0487 using quarterly vacancy sweep money to cover the remainder of this fiscal year.
Is there support?
Support.
It's been moved and supported that we amend the motion. Would you restate it one more time, Commissioner?
The motion would be to approve Resolution 2026-0487 using quarterly vacancy sweep funds to pay for this contract for the remainder of this fiscal year, July 1st through September 30th.
Okay, thank you, Commissioner. Do we have discussion on the amendment? Commissioner Shoemaker and then Commissioner Kuzino.
Okay, thank you, Mr. Chair. First of all, obviously, we're entering into a 3-year agreement. They're not just willing to do it for 2 months, so if we can't come up with a way to fund it, and we don't agree for the sweep money to go through further, we're gonna have to come up with some other way to do it. I'm not a big fan of taking that money out of there because we didn't have staff that we had hired or did, and they didn't show or whatever reason we had this extra cash because we didn't spend it on employees. So everybody understands what we're talking about when we say sweep money to the residents or anyone else. That's not a long-term strategy, unfortunately, and then we're talking for after 3 months, we got 3 months left to go with, and you're saying roughly a little under $80,000. So let's say it's $26,000 a month increase. We're still talking of an increase then of roughly 10 months is $260,000, roughly $300,000. We're talking an increase that we have to come up with annually. That's, Crystal said 1 quarter we had, how much was the 270 the one was?
Yeah, the second quarter was less. It was over 200,000, but I don't remember the exact dollar amount.
And those funds are there, but we also were taking those funds, if this board can think back, we came up with a capital improvement plan and the way we were gonna fund that, because we'd never done that before. We'd never had anything like that down there, and we'd had a lot of meetings about it, and we decided that, guess what? This is the best way forward, because we need to improve and take care of our facilities. So if now we're gonna start taking it from there, who's gonna fund to take care of the facility? Who's gonna fund putting a roof on? Who's gonna fund doing the parking lots? Who's gonna fund, where are we gonna fund those projects from? So that's one of my concerns. I just don't think it's a long-term plan. So, if I may, Mr. Chair,
You may.
continue. To be clear, this is not about Aramark. It's not about canteen. This is about how do you fund it? And that's the question, long-term. Because in 3 years, this probably ain't gonna go down anymore, and I'm sure they're smart enough to go, yeah, we see the projections, we know where things are going. I just, like I said, we gave away at 1.5 million a couple weeks ago. Because every time somebody comes to this board, we think something sweet and nice, and wasn't that kind and great? Oh, well, here we go, we'll give you it. We can't keep doing that. That's not a substantial plan for moving forward in the future. We have, somebody said we had a responsibility for certain things, but we have a fiduciary responsibility. That's our first and foremost. Commissioner Kuzno and I were up in my office earlier today talking about, we have to make sure this county is solvent and can financially handle its responsibilities to its residents and to its employees, and also if we want the inmates. So back to that, how do we, if we don't fund it through the sweep, because you're only talking 3 months. You have to fund it next year. And I think Commissioner Kuzno's on board with me that we'd like to have this figured out for the next 3 years, how we're gonna fund it tonight. I'm there. I'd like to know how we're gonna fund it for the next 3 years tonight. I think that's the answer I'd be happy with. Whether it is Airmark or Canteen, we have an increase, we gotta figure out where it's gonna come from. So thank you, Mr. Chair.
You're welcome. Commissioner Kuzno.
Can't say it any better. I agree with him 100%. You just, to come up with a simple solution, and it is a solution, and I don't mean to degrade it in any way whatsoever, Commissioner, but it's just another case of kicking the can down the road, even if it's just for a few months. And so I agree with Mr. Shoemaker. I would like to see the problem solved now for the 3-year contract, not just the next month or two.
Commissioner Flewelly.
Thank you, Mr. Chair. I agree wholeheartedly. I understand what you're saying. So doing some quick math here, we gotta feed them, right? They gotta be fed. Airmark's lowest bid. Canteen's right in the middle. So looking at the 5-year cost, obviously we're doing a 3-year contract, so you look at a 3-year contract, the difference is about $560,000, right? Divide that by 3, what do you get per year? I did 5 years, so I'm gonna do it again real quick. Don't mind me. So you got $186,667. That's the difference between Airmark and Canteen. Now, is there programs that we can cut? Is there things within the sheriff's budget we can come up with at $187,000 per year? Because we have to feed them, right? And while I know we gotta feed them somehow, Airmark's the cheapest, this one's not the most expensive, it's right in the middle. What's our one statutory duty when it comes to the sheriff's office? Having a jail, right? Now, I don't think we want to skip out on our only statutory duty. What I would like to hear is anybody else besides us 3 have any ideas? Marty's the finance chair, knows budget better than anybody. Except for Crystal, of course. Is there somewhere we can come up with this? Because either way, there's an increase, yeah? Even if we stick with Airmark and give them fake sausage and soy patties with mush, we gotta cover the increase. So we gotta have an idea how to cover the increase, right? Where do you come up with $187,000 a year within the sheriff's budget? Any ideas, Crystal? Yeah.
I was telling a couple commissioners I talked to, I can't remember who they were. When I go through the budget process, I do make a list of things so that if we do get to a point where we have to cut, these would be my recommendations to bring to the board, and then you would make the decision yes or no. So I know that there are some things that we can put on that list that you could take out of their budget if you wanted to accommodate this.
Okay.
But it would be up to you to decide if you agree or disagree on those items.
Well, I mean, do we want those options? I'm on board with Commissioner Kuzo and Commissioner Shoemaker. We need to make a decision tonight. These folks gotta eat tomorrow. They gotta eat July 2nd. So if we have to lose $187,000 to put in this, we need to know.
All set. Mr. Shoemaker.
Just real quick, I just want to clarify to everyone, that's the increase between Airmark. The real increase is around $312,000 annually.
Yes. Well, the initial proposal.
From
was,
compared to
yes.
last year, what we were paying to what the
Full
increase
year.
will be for this is about $312,000. So it's not
That
180.
was the middle offer, so the new offer would be
So we
less
gotta come up
than
with
that.
312 roughly.
Right, but we'd have to come up with more for the increase on Airmark too.
No,
That's what I'm saying.
I understand, but I understand what you're saying. What I'm trying to say is, either way, we've got to come up with those funds somewhere. So yes, we have to do something, but well, let's be realistic. This is the number, where we're at, and so I'd love to hear options or additional options other people have. Here's my fear, though. I don't want to have and take it from the sheriff's department budget, something they need, and we go, oh, that's great, okay, And they're like, no, that's not a program we're willing to give up. Nobody wants to give up any programs in their department, I understand, or anything else like that, but, you know, a 5% increase or something like that, you might expect, but where we're at now, that's increasingly large. So, thank you.
You're welcome. Commissioner Getzinger.
I don't feel the urgency to work for the next 2 years in that I think we've got the 3 months taken care of, which gives, as we enter into our budget hearings, and I think we have time. To me, the reasonable thing to do would be to take a look at everything as we enter into the budget, and how do we solve that? Does it all go against the sheriff's funds, or do we take a little bit from everybody, or we take it all from somebody else? But I think rather than sit here and make some decision tonight on that, I think you need to give Crystal and her staff some time to look things over, and we've got from now to July to figure out how to pay for it, and we'll do that.
All right, I'll if I may lean into that, I was going to say something similar. If the sweep can get us through the end of the fiscal year, as I understand it, that's the motion on the floor to amend. I think the budget season with the hearings and everything that goes into that will just have to be laser focused on, I mean, we have to adopt a balanced budget, right? By law, by state constitution, I think. So my view would be along the lines of what Vice Chair Getzinger is saying, that we get through the next several months and we be very deliberate about how we approach budget season. And one thing I've asked, this is related, Crystal, for the June 3rd workshop, there's going to be two components to that. One is the Senior Services Task Force is going to come in and by our resolution, share their recommendations and what they found in terms of senior services and needs and spending there. But the second half of that is going to be Crystal talking about long-term projections, and by long-term, just the next several years. We're not looking at, but it seems to me that many of our discussions lately, whether it's this issue, the recycling center, other spending items that involve money that we may not have, that we're dealing with them on a one-off basis, an individual item basis, but it's the same discussion. It's, do we have enough money? And I don't think any of us, well, some of us have more information than others on that topic. So one thing that I've asked her to do is come and spend 45 minutes or an hour as we go into budget season, level setting for all of us in terms of what's the projection for spending based on our current commitments, what's the projection on income for the county, as best as we can get it, knowing it's not, neither will be right on the money, but as best as we can do. And then also things that are waiting in the wings where we know that different departments are going to be coming to us because they feel they need more, either because ARPA's ending or the prosecutor may not get the full $3 million, or many other things that could impact their budget. So that will be half of our workshop on June the 3rd. So that's a long way of saying I support Commissioner Flewelling's attempt to amend this so that we do have a source to pay for it, at least in the short term, and then we will do our due diligence as a Board of Commissioners and do our duty on budget season to make sure that we have a balanced budget coming out of that. Mr. Flewelling.
Thank you, Mr. Chair. And to be clear, it wasn't an attempt to kick a can down the road. It was just an attempt to get it into budget season. I do have one quick question though. Do you have any inmates that have specific dietary needs, so they get different meals?
Yes.
Okay. So this is gonna be an unpopular question, but is this health related?
Say again.
Is this health related? Can we use $312,000 out of the health services millage fund balance to pay for this program next 3 years? Crystal?
That would be, yeah, that would be a
Ryan?
legal question that I would
Question, yeah.
say that you would need to study and bring back to the board.
Yeah, I would need to look into that, but off the top of my head, that doesn't sound like something that would be, I mean, I guess unless there are meals that are medically needed.
There are those that are diabetic or high protein, those that are pregnant, they have a different meal set for them coming.
It's something I can look into.
It's just a thought. Nutrition's health-based, right? So if it's something we're looking for the money, we've got a fund balance in the health services millage, $312,000 to pay for the difference for the next 3 years. You've already got a budget set up with the current pricing, which will fit in the general fund budget for next year and the next 3 years. Just thought.
I like the way you think, Commissioner Flewelling, that
Thanks,
we'll
sir.
find out.
I'll look into it.
Thank you.
Yes.
I was gonna say it's 312 every year.
The amount,
So, yeah,
okay.
so we need 900,000 plus.
So,
Okay.
900.
900,000 out of it.
But I like where you're going with that, though.
Discussion is on the amendment. The amendment is to use the budget sweep for the positions to fund the next several months for this contract, but also, well, the second part of it, once we adopt that, we'll be back to them. Is there additional discussion on the proposed amendment? All those in favor, please signify by saying aye.
Aye.
Any opposed? I believe it's 6-2. All right. So the amendment passes. We're back to the main motion as amended. Is there additional discussion on the main motion? The main motion is to pass the contract as amended in terms of the funding mechanism. And it's a 3-year contract. Am I right on that? All right. With the new best and final. I always thought final meant final, but best doesn't mean best. Best, the new best and final. Thank you, gentlemen, for your willingness to work with Captain Kennemer and others. Additional discussion. All those in favor, please signify by saying aye.
Aye.
Any opposed? It is passed, 6-2. All right, next item on our agenda, we're entering our workshop discussion items. The first one is the health services millage. And let me say how I think we got here. So we have a health services millage in the county that funds healthcare services for people who do not have health care and do not qualify for other healthcare options, including Medicaid. And that was passed 20-some years ago. It's up for renewal. It comes to us in terms of whether this body wants to put it on the ballot for renewal. It's up to us through a majority vote to do that. We had some discussion, lengthy discussions on this a couple of times, postponing the resolution, I think twice, and this is the second time it's been postponed to this meeting. We did say at our last study session on this topic that we would ask a small group of people to get together and talk about solutions along the lines of what commissioners' concerns were. And so Mr. Freeman led the creation of that group. I believe Commissioner Getzinger and I were part of it. Is that right? And there were others, some folks in the audience, I think. Josh, would you maybe indicate who was part of that? And then I guess you all have a presentation.
Yeah. So it was you and Commissioner Getzinger attended at least one each session. There was 2 of them. Jim Milanowski, who is from Genesee Health Plan, was there. Michelle Estelle, who is our health officer, was there. Jim Ananek from the Greater Flint Health Coalition, and then Jared and myself from the board's office were there to discuss this issue. You'll remember that when you presented this to us, you wanted us to come back with maybe 3 options of how we could kind of focus on three main areas, which we'll get to. We did meet twice, like I said, in May to discuss kind of these 3 options. What's the future of the healthcare services millage? I think there was some general consensus on the board that our current way of operating this millage is a little bit stale, and that maybe we could do something better. We did discuss renewal of that millage, and then also finding a path for both short-term stability, right? The people that are on the millage, the things that we are currently using the millage for, and then also long-term improvement. I think, and if I'm missing anything, Jim or Michelle, please step up and fill in those blanks. I think we realized pretty quickly that these decisions should not be rushed, right? Because we're playing with people's lives, basically. These folks, a little bit over 3,000 people are on using the millage services currently, and we don't want to cause harm to those folks. We also thought, as I said, major changes require better time and data. The Medicaid changes that were recently enacted in DC go into effect in January. Jim? Requirements go into effect in January. And if we kind of, we felt that we needed some time to understand what that impact was going to be on this group of people, right? Is it gonna increase the number of people who need to participate in the Genesee Health Plan? Does it make any change at all? We needed real data to provide recommendations to you. We also found out fairly quickly in these discussions that we're not going to change health outcomes with a quick fix. There is no quick fix that's going to solve the current concerns that this board has been talking about, especially you, Commissioner Kuzno, for quite some time. And then, as I said earlier, you know, these Medicaid and SNAP changes that are going to be taking place early next year, we need some time to understand what those impacts are and allow that understanding to drive future decision-making. You know, we talked about how do we establish some sort of a work group or a study group that can look over these issues over time with the understanding that this group would be charged by a date specific to bring recommendations back to this board. We talked about late spring, early summer, which would give us, you know, several months of that new data with the changes in Medicaid as kind of a target of when we could bring back some recommendations to this board, and that early summertime would align with our upcoming budget process for the next fiscal year that would allow this board to have that data to make decisions on how they were going to use these funds forward. So trying to align that around the budget process for you to make those decisions. Our core priorities, we thought, our core charge from this board was to make sure that we maintain access to care for those who currently use the millage services, improve health outcomes through innovation. We shouldn't be doing the same thing that we've been doing for the last 20 years. Times have changed, so should the way we operate should also change. And then reduce duplication of services. I think that anybody that's been in Flint and Genesee County for any amount of time understands that everybody is fighting for ever-shrinking piece of the pie, and we are often duplicating. We're not very efficient in dividing that pie up in the community. We talked about some of this earlier. We want to improve health outcomes deliberately. We don't want to just make a knee-jerk reaction. One-time programs alone aren't going to be enough. And focusing on those social determinants of health and how do we impact those so that we can catch that baby upstream versus, or why that baby is upstream, as Dr. Brown says, versus trying to just snatch the babies downstream. A second here. We talked about who would be participants in this work group. You know, obviously there's some players in the county that just make sense to be included. Genesee Health Plan, Greater Flint Health Coalition, who, you know, kind of does this work countywide for us. Obviously, our health department, Hamilton and Community Health Network, Genesee Community Health Center, you know, members from our local hospitals. Jim has talked about Michigan State is currently conducting a review on behalf of Genesee Health Plan. So it would make sense that we include them, and maybe somebody from the Flint and Genesee group who can take that small business perspective and understand the burden of healthcare on small businesses and what that might look like as we move forward. Some of the topics that we talked about, you know, care navigation, chronic disease management, what are those drivers of cost? And how do we connect people to services that are more appropriate and provide maybe a better level of care or a less cost for a level of care. Pilot program for residents with complex needs, kind of that chronic disease management. Strategies that will retain physicians in Genesee County. There is, across the board, some issues with finding, for sure, family practice type, you know, non-specialized physicians that are working in Genesee County. We had talked around Medicaid. The state of Michigan had previously started a waiver for Medicaid coverage for jail-related health services. Right now, an inmate goes into jail, they are cut off Medicaid, and that becomes the full responsibility of the county. And then savings that could be redirected to other health priorities. So maybe we're not doing this anymore, and we can redirect those savings to something that has a bigger or a larger impact for residents. We kind of settled on a recommendation to move forward. We do believe that we should place this millage renewal on the ballot, but let's limit it to 5 years. That within that 5 years, it's shorter than the normal 10-year or 7-year that has historically happened with that. But we felt like that would give some push or some incentive to really come with some serious recommendations to this board that will show results for not just this board, but for the community as a whole. I would suggest that if you put this on the ballot, that in the language that approves that you create the work group to study these things and set the timeline for when you expect recommendations from that work group so that you can make a decision on moving forward. One of the major reasons we wanted to put that renewal back on the ballot is we do want to preserve access to care now for those who utilize and depend on this service as we're planning for more efficient use of funds in the future. It is important. It was important. It was a large topic of our discussion. We don't want to, throw the baby out with the bathwater. We do have a large group of people who depend on this and need this moving forward. As part of that work group, one of the recommendations coming back will be some sort of a formal process to evaluate those improvements. There'll be recommendations. You guys will either accept or deny those recommendations. For those that are accepted, there needs to be some sort of an evaluation process that can measure success and determine whether or not, both short-term and long-term, whether or not those are something that we should continue to do. But then also, and finally, I think most importantly, and I think this is for sure that what we heard the most from this board was we want to modernize how millage funds are used over time. Like I said at the beginning, I think there was some general consensus from this board that we should be doing something different. We should be innovating in the way that we're delivering these services or these programs to our residents to really kind of stretch those dollars as far as we can. So those are our recommendations on the end. There is no sense of urgency to act tonight. We would have to act by August 11th to get it on the November ballot. That's the only ballot this year that it can go on at this point because of timing. But we wanted to make sure that we had some sort of a recommendation to you as we were charged to do, without it just being some haphazard.
Thank you, Mr. Freeman, for presenting the results, the recommendations from the work group. Thank you to Mr. Milanowski and to Ms. Estelle, and also Commissioner Getzinger and the others who were part of this over the past month or so. I did want, before we get into some discussion, could you remind the Board of Commissioners and the folks watching how much the millage takes in, and I think you know this, total every year approximately, and then the pots that the millage dollars goes to funding?
Yes, maybe. So this year, I think we're expected to bring in just about $13 million. $7 million of that is earmarked for Genesee Health Plan. 7, Jim? Yeah. 5.3 million is earmarked for healthcare in the jail. There's $2 million that's budgeted right now, but that, as I've said before, that number fluctuates for payments to hospitals for uncompensated care. So what does that get us to? That's about, that's almost 13 million right there.
Okay. And then before I open it, you mentioned that there were 3,000 people that benefited from the millage at the start. Were you only counting GHP members, or does that include jail inmates as well?
Nope, that was just those who are specifically signed up through GHP.
So the inmates truly should be part of that.
Yeah, and that was the discussion when we made that change a number of years ago, was that had these people that are currently housed in the jail, if they were out on the street, would they be eligible for this program? And they would be. So that's how we talked about, well, why shouldn't we be using some of these dollars to pay for that as well, for the care,
Okay.
healthcare.
Do we have a conversation? This is a workshop, so it's supposed to be a little less formal, even though we're in the boardroom. Conversation on this topic. Mr. Getzinger.
A question about the jail. Have we ever like kind of challenged or anything as far as you say they lose their benefits?
They do. So there's been other states, I know California for sure, has applied for a Medicaid waiver. And Jim, maybe you can speak to this a little more in depth than me, but my understanding is that Michigan started that process, and then with the changes that recently happened at the federal level, they have pulled that back to see how that's going to play out before they continue pursuing it.
Yeah, there's other states that do this well. California, as Mr. Freeman mentioned, state of Washington. So I think there's some work to be done in that area, and I think, working with the state on getting that 1130 waiver, as they were starting to work on it, would be one effective recommendation that we could work on, yes.
Is that something our lobbyists could work on?
Sure.
Well, in the meetings that I've sat in, I think what's happening is exactly what we hope to have happened by our discussions. I think everybody's taking a look at their operation and trying to update and, eliminate duplication. And I've had very positive conversations with the groups that I've been with. And I think it's something we should move forward with. And that'll, if we're cutting it back to 5 years, that gives us some time to redo things, change some things if they need to be, review things. And I don't see a lot of reason why we wouldn't move forward tonight.
So there's no motion on the floor, but we got discussion, Mr. Shoemaker.
Thank you, Mr. Chair. When we had our last workshop, I had some questions, and I still haven't had the answers to these brought to me. So the first was, we were told this is pretty much the only millage like this in the state. Left, no other county has a millage, healthcare millage like this, other than a mental health millage. A few mental health millages are around. That's from there, if I'm remembering that correctly.
Mm-hmm.
Okay.
Correct.
And I asked, what do other counties do? And I'm still waiting for that. So I'm just trying. Yeah.
Hi.
Hey.
I'm Michelle. So I did reach out to the state, and I reached out to a few other counties. So we are not the only county that has something similar. When I spoke to Laura Delamorellier from the state, there are a few rural counties that have a similar program, and I believe it was possibly Kent County, I could be wrong, that has something similar as well. I believe in Kent County they moved away from it. There was something, I don't know what it was, but something that blocked it. But, so they had to move away from it, and they may be considering it something similar again. I will say some of the other counties that have it, they also have their FQHC connected with their health department, which we do not. So they can use it a little, like they can do some of the long-term care there at the health department and do it there as well. Some of the things they brought up is like the way we're set up in Flint, and a lot of the social determinants of health and the tax base in the other counties, which help them, well, they don't need a program like this as much. I think some of the things we have to consider is if we don't have this plan, then somehow it's going to fall back on the county to take care of it anyway. I guess that was the conversation I had with them.
Mr.
Thank you.
Shoemaker.
Thank you, Mr. Chair, and thank you. Like I said, I'm trying to wrap my head around this, because since this millage really passed, obviously we have the Affordable Care Act, and Medicaid, Medicare are up and down certain times what they cover, what they will not cover, and who they will not cover. So explain to me, when we're doing Genesee Health Plan, what is the requirement to qualify for us to pay for your benefits? Or this, should I say the taxpayer pay for the program? If you're
What
an
are the eligibility guidelines?
Yeah, what are the guidelines? Yes, please.
So they have to first be a Genesee County resident. They have to show or prove that. They can't have any other healthcare insurance, so they have to be uninsured. And then they have income guidelines that they have to meet, and that's at 250% of federal poverty level.
Which is how much, roughly?
For one person, about 30,000.
So, and this is just me doing rough numbers. Medicaid kicks in if you're a single person at 21 grand. And a family of four, this is just, like I said, now I'm not 100% on this, but these are the conversations I'd like to have further. Family of four is around $43,000 when Medicaid kicks in. So, to Mr. Freeman's point, and I do appreciate this, and I do appreciate the information, I really appreciate the point of duplicate services, this is something I think we have time to look at, and we need to get it right. It's very important. We've got other budgetary issues, and yes, this covers some of our problems. But we also have a lot of residents out there who, guess what, who don't qualify for these programs, but guess what, are still struggling to make ends meet, still struggling to pay their bills, still struggling to get by. And this is an additional burden on their taxes. We have a lot of seniors that, guess what, they may have paid off their house years ago, but guess what, they still don't own their house, because guess what, if they don't pay us or pay these millages, guess what, the county's coming to get their house. So these are things we gotta look into completely. I have a few other questions that I'd like to work through with, we don't need to do it here, but with Genesee Health Plan, I have a few other questions about outreach and a few other things. I would like to discuss this further, but, you know, I can continue with my questions tonight if there's the appetite from this board to move forward tonight, but, you know, I'd prefer to have.
We don't have to move forward tonight. I did have Josh print out the resolution, so we would at least have a copy in case we decided to do that. You know, Mr. Lloyd's not here, and this is a significant issue, so I mean, we've taken a vote without him, but I think this is important enough that we might want to try to have a full commission. It's a study session, so I think you should ask your questions so we can all hear.
Well, one, here, just real quick here, it says 7 years on here. Am I seeing this wrong?
That was the original proposal, I believe.
5?
Yeah, so this is what we had a couple of weeks ago, or maybe a month ago. It is still written as it was, but as I understand it, the recommendation from the work group is limited to 5 years. And Jim, I don't think you actually introduced yourself by name and title. Could you
Jim
do
Malinowski,
that?
CEO of the Genesee Health Plan.
Thank you. Mr. Shoemaker?
Thank you. So if we're ready for somebody to dig into those numbers and find out if I'm correct that it's a single person at 21,000 and a family of four at 43,000, then here's my question. Why are we providing this service then? If our threshold is higher, why are we not making sure they're put on these other programs, saving our residents money, saving our businesses money? So they can invest in their business?
Sean, I was under the impression that the other eligibility requirement is that they didn't qualify for anything else, including Medicaid, which is
Yeah.
what you're asking about, so maybe.
Can I address that?
Of course, yeah.
So yes, Commissioner Shoemaker, we sit down with them. If you came into my office and said, I have no health insurance, we double check, make sure they don't have Medicaid or commercial insurance. We can get on the state CHAMP system and do that. Then we see if they meet our income guidelines. And if they do qualify for Medicaid, we don't sign them up for the Genesee Health Plan, we sign them up for Medicaid. Our staff can do that. If they qualify for Medicare, if they're senior, or we'll sign them up for Medicare. Our staff can sign them up, for doing all of those things. So we're not duplicating, it's based on what they qualify for. We're gonna put them in the right pot, so to speak. What coverage is gonna be best for them. So we don't cover people that qualify for other things.
Mr. Shoemaker?
What would make them not qualify for Medicare if they're under the income threshold? And with the new changes in Washington, from what I understand, is some of these people are actually gonna have to go out and actually work. So are we gonna cover people now that, guess what, they don't wanna work? So guess what, now, yeah, you qualify for Genesee Health Plan, so we're taking more funds from the health plan or from the millage and putting them into the health plan. Is that what you see happening also? First, let's go to the first question, I'm sorry.
Okay.
Let me slow it down, I apologize.
No, no problem.
First one overall is, other than income threshold, what would be the reason they're not qualifying for Medicare?
For Medicare or Medicaid?
Medicaid, I'm sorry, I apologize.
Medicaid is that normally they're over that threshold. They're in that, they're over the threshold of Medicaid and under the ACA threshold. And so they're kind of in that gap, in that middle area. And so if they qualify for Medicaid, and that's at I think it's like 149% of FPL or below, that's what we sign them up for. If they're between 140, that and the ACA, we'll sign them up for Genesee Health Plan. If they qualify for the Affordable Care Act, we sign them up for that.
So
It's
what,
almost like name that tune. They come in and we figure out what they qualify for.
what would make them not qualify for the Affordable Care Act?
Cost mostly, the cost of a premium and that's usually the reason why they don't qualify for that.
So, and forgive me, I know we've been through this years ago, but we'll do it again. So they come in, they make too much money to qualify for federal, as far as assistance, as far as what we're gonna go with Medicaid. And then you're gonna go to one of the sites for Affordable Care Act. Everybody's supposed to be able to sign up for health insurance on the Affordable Care Act. That's what we were sold, that's what it's supposed to do.
Mm-hmm.
So who determines that that won't work for them? You're doing a budgeting schedule for them and saying, hey, you can't afford this? Or they're doing a budgeting schedule and say, hey, we can't afford this, give us the insurance?
Well, first of all, there's only a 2-month open enrollment for the Affordable Care Act.
Unless a catastrophic
Yeah.
event.
So, yeah, so I mean, so there is a limited amount. So if they come in and they don't meet that catastrophic definition and they're outside of the open enrollment period, then we will put them on the health plan until at that time when there's open enrollment.
And catastrophic can be all the way down to loss of job.
Could be, yes.
Yeah.
Yeah.
So there's a lot of reasons they qualify for this. So I'm just trying to understand that we could be getting people that probably could afford to pay $50 to $70 a month for insurance, but you decide they can't afford that, or they
Mr.
decide they
Shoemaker,
can't afford
there's no $70 plan on the ACA.
it? Really? Because that's what I was sold when he pitched it, that they were going to be. So I'm
But
asking.
when I pitched
No,
that-
I said
Okay.
when they pitched it. When the president and his group pitched it to begin with, health insurance costs were supposed to be under control, and since then, we've seen about a 12% average increase annually. Yeah, I'm there. What I'm asking you is this. We have middle-class families trying to struggle to pay their bills.
Absolutely.
I don't want to see people coming in there and taking advantage of it. I'm trying to understand who decides whether they go and sign up for the Affordable Care Act, and what is that threshold that says you're not going to do it. Genesee County residents are going to pay for you on top of paying their federal taxes. What's the threshold? What determines what that number is, or what that criteria is that they go to your program or they go on the Affordable Care Act?
If they qualify for the ACA, that's what we would sign them up for. Unless it's outside of the open enrollment period or they don't meet the catastrophic time periods.
So what type of people don't qualify for the Affordable Care Act then? What would make you not qualify? If I came in, and what would make me not qualify for the Affordable Care Act? So then I'd have to go on your program.
There's, again, it's just if they're outside of the open enrollment period or they don't meet the criteria for, to be enrolled in between.
Sean, if I may, is it that they don't have income sufficient to pay even the lowest premium in the Affordable Care Act?
That is correct. So they will choose not to be insured.
So they may be, quote, eligible,
Correct.
but if they don't have enough income to pay whatever the
Right.
lowest, so.
Thank you. I guess what I'm trying to say is there's a lot of families making tough choices. And there are other opportunities, and now we're just putting another burden on the back of our residents. Like I said, I'm one of the people that if this does pass or it does go through, that believes we need to fundamentally look at a different way of doing this. Commissioner Kuzno's brought up for years, we're one of the unhealthiest counties around, if not the most unhealthy.
Unhealthy, and we spend more.
Yep, and we spend more per person. So what we're doing is not working. So, like I said, I realize we've built our budget around needing this millage, because when I first got down here, we weren't taking any of the funds from this millage to pay for our inmates. And because we've found creative ways to do it, you know, we've taken from this program, and yours numbers have went down, if I'm correct, over the years from there, so I fully understand it. It's really just whether the individual feels they can afford what the Affordable Care Act is, and then if not, you sign them up for what we have, or what you have to offer them.
Only if
Or
they're outside of those.
Yeah, or if they're
guidelines.
catastrophic. Yeah,
Yes.
if they feel they can't afford it, it's catastrophic.
Then they
or-
walk away without it.
Okay, thank you. Thank you, Mr. Chair.
Mr. Flually.
Thank you, Mr. Chair. Jim, a couple questions, kind of piggybacking off Commissioner Shoemaker's, but going back a couple of workshops.
Yeah.
Just remind me here, I thought you said we're the only county in the state of Michigan with a health plan like this?
That it's funded by a millage.
Okay. But I thought you said we're the only county in the nation with a millage to fund that plan.
That is correct. There
Okay.
are other county health plans that are still in existence.
Okay.
Yes.
So a question, I'm not sure who was up here with you.
Yeah.
Michelle, okay. So I just, out of curiosity, these other counties, we're the fifth largest county in the state. So Wayne County, Oakland County, they don't have a county plan?
Which counties, like Wayne, no.
Oakland County, Wayne County, they don't have a county plan.
No.
So you made the statement that if we didn't have this plan, it would ultimately still be on the county to take care of these people. So I'm just wondering what that process would look like and what these other counties, you know, the other top 4 counties that don't have a county plan, what they do to take care of those uninsured residents. Does that make sense to you?
Yeah. I know some of the counties, they have the health plan. I believe it's not through a millage, but it's still through their taxes.
Mm-hmm.
Through the taxes, but not specifically millage. And, well, I guess I don't know, because not from a millage. I guess I don't know.
So even here in Genesee County, we have a free clinic. A lot of these communities have free clinics. They don't have unlimited access and people, you know, to see them. There's limitations there. We have a federally qualified health center. And we have a health department. Health department does preventative care. They don't do primary care or anything along those lines. The FQHCs can do primary care, but they operate under reimbursement or under a sliding scale. There's a charge for that. There's not free care out there for those folks. And so that's what other counties, really, it's the same for all their counties. They have basically those 3 health systems, or they can go to their provider that they've been going to for years and pay out of pocket, whatever.
And don't get me wrong, I'm not attacking you guys or Genesee Health Plan or
No,
anything
no.
else. I'm trying to work through this
Yeah.
as we go through
But
this.
that's what other counties do.
Okay, so,
People use hospitals as
right, and
care.
yeah, some of us don't have primary doctors, that's what happens, right? So, and I understand all that, and I guess where I'm going with this is if this millage didn't exist, are there options for people to get that care? I mean, because these other counties that don't do it, what would that look like, I guess is what I'm trying to get at. Other places that don't have it, other places that do it, right? I'm not making a statement for or against it, but what would it look like? Because if you have all these other counties that make this happen and nationwide, and I know, you know, rural rural healthcare is an issue. I've got a place in a rural county that the income level varies. There's only 10,000 people, but they don't have it. So when we look at this, if we look at these other counties, and Commissioner Kuzno spoke about it a lot, we have this, now I gotta try to get it out again. We are the second worst county health outcome-wise in the state of Michigan. But yet, when I look through this packet, we have almost an alphabet soup of organizations that are affiliated with healthcare in this county. So, is there something, and I know you had a work group, is there something we need to look at differently here? Because to me, on paper, status quo. We're gonna put it back on the ballot, we're gonna pass it, we're gonna keep doing the same things. And, you know, the definition of insanity is doing the same thing over and over again and expecting a different outcome. So my question to you is just that, these other counties, like where does Wayne County, Oakland County, Kent County, Kalamazoo County, where do these counties rank as far as health-wise? You know, throughout the state of Michigan, if they don't have these plans, is there a model that we can use or we can look at that's working a little bit better for them maybe, than what we've been doing? Look, I understand it's, a lot of it's personal choice too, right? Everyone wants to go to McDonald's instead of making their food at home.
There's a number of things, and a lot
Sure.
of them have to do with the social determinants of health, so access to care,
Yeah.
being able to get to that
Sure.
care, having providers to provide the
Sure.
care, people being able to get to that care.
Sure.
Even when we did our, recent study, strategic plan, that one of the things that continually came up was access to care, navigating the healthcare system. They need individuals, you know, to help them follow through and navigate the system and understand. You can even have healthcare and you start asking questions and you don't know where to go. And a lot of people give up. If they can't get to the care, you have an appointment, you can't get to the care, or if you can't pay for the medicine, you can't pay for what you have, all of that is a factor here. And we may be one of the bigger counties, but I don't think we're one of the richest counties, you know, either. So
Sure.
Those things factor into it. It's a big factor.
Sure, and I know we're not the richest
Yeah,
county, for
yeah,
sure,
so-
absolutely. But when we get to that point too, and to Commissioner Shoemaker's point, we're not the richest county, and so, you know, everything we tax on, tax-wise, is a burden on everybody else, right? And so, you know, I understand, I mean, Jim, you just listed, what, half a dozen things, if not more, half a dozen ways that people get to that healthcare. You know, we have MTA, we have these other things, right? So I guess where my head goes is, what did we do with Obamacare? Right? We provided health care, but all we did is give the insurance companies more money. We didn't reform the healthcare system. And my fear is that's what we're doing here. We're throwing more money at a problem without looking at if there's other solutions that work in other places. And like you said, we're not the richest county, right? But maybe we need to develop a sliding scale to show, you know, medium income level, taxable value versus health outcomes. You know, maybe if you did that, we'd be in the middle, maybe, right? So maybe that would show this is working a little bit better than what we're seeing now. That's all I'm asking is, you know, what do these other counties do? So, thank you, Mr. Chair.
You're welcome. I think the dialogue is good. Others want to, Mr. Kuzino?
Josh, wake up. What is the fund balance for that fund? Where's that at? Just under 10?
Yeah, I think at the end of September 9/30, Crystal, it was around 9 or 10 million, is that correct? Yeah. No, for the health plan. Health services millage. Yes, that's what it is.
What I'm, you know, Jim and Pam, you guys can sit down. This is for Josh.
Okay, all right.
Thank you.
What I was leaning towards was to use that fund balance over the next 5 years so that we could levy a little bit less. Do you understand what I'm saying?
No, yeah, I do understand, but if you look at what we're going to collect, what we're projected to collect this year, $13 million. Genesee Health Plan is projected to use 7. The jail is around 5.3, so that's, 12 and
That's your
12 and a
12.
half.
Yeah. And then you had some others.
Yep,
So that was
payments to
right up to
hospitals,
13.
yeah.
So what I'm saying is over 5 years, if you take 2 million of that, you wouldn't have to levy that to get that 13.
It would be insignificant. Right? Because the full levy right now gets you 13, you need 12 and a half to just maintain status quo,
Right, and
no
if you
changes.
use 12, or 2 out of that per year for 5 years, then you
Oh,
only need
yeah,
10.
yeah, I got you, I got what you're
So
saying.
you don't need to levy the full mill, you could take and do it for whatever it comes out to,
Yeah. Yeah, I think,
7/8 of a mill or whatever.
Right, yeah,
But,
you figure-
Anything's better, is at least something.
yeah,
To show the taxpayers that you're, being considerate of their pocketbook.
for sure. Yeah, .1 gets you just over $1 million a year.
Yeah, so
Point
.2.
one, yeah.
Yeah.
Yep. I was confused.
I am too.
So, Marty, are you suggesting that perhaps that we wouldn't necessarily put it on the ballot for renewal and we just spend down, well, we wouldn't have a millage to levy next year if it,
Still have the
You-
millage,
yeah.
but instead of a full, you do 8 tenths.
when we do our annual
Yeah.
levy?
Well, I wouldn't even do that. I would, I'm not saying to even do
December.
it that way. I'm saying just put it on the millage for renewal at .8
I see,
instead
okay,
of 1.
got it. This expires in December, is that right?
Yes.
End of this calendar year?
Yes.
Uh,
So you would,
No, I can't hear.
yeah, our equalization director.
You're like the equalization superhero. Please come forward.
So, thank you for addressing, let me
You're
address.
welcome.
So with the millage, you don't, if you're gonna put it on the ballot to renew it, you have to put it on at equal or less than what you levied the prior year. So if you're gonna put it on at the 9.9680, it's gonna be considered a new millage. After, if you wait till next year, cause we're gonna have a rollback this year. So if you want to make sure that you can put it on at what you want the highest to be, because you can at your budget hearing determine what you need for that revenue, and you don't have to levy the full amount. So you can ask, so if you were saying,
Well, I
put it
know-
on at the lower amount, but you're not gonna wanna do that because you can never now get that back if you need it
In 5 years, you could.
in 5 years, yes. But
Well,
if the
my
budget's
fear- my-
changing,
The reason I'm saying it this way is because we have never done it that way.
Right.
We have always levied whatever it is.
yeah,
We've never reduced it. So therefore, that's why I'm phrasing it the way I
Right.
am.
Yeah, and
Because
you
I know
don't-
we won't.
if you know you're not going to, but you don't have
I
to do
know
it
it's
that
an
way.
option, but I'm telling you, we won't.
Because I know we have several, couple townships that do that right now. They can levy, they have their maximum amount that they can levy after the rollback. But when they do their budget, they say, we only need this much revenue, so that's all they levy that year. And you're not stuck at that levy, because you can always levy the next year the maximum amount. So,
Yeah, I know. We're not
Yeah.
that smart,
so,
though.
huh,
We got some smart townships, but not all that smart.
yeah, but
And we're
just saying, if you don't want to limit yourself to putting that lower amount on there, right?
I'm
at
just
that
making
time.
fun with you right now.
It's okay, you can. So I just wanted to make sure that you knew that you could do that
Know
way.
what you're
So,
saying, yeah.
I don't know if you have any other questions on that.
May I offer something? So related to the fund balance, I've been listening closely in previous meetings and then tonight, and combining that in my mind with the desire for more innovation, better health outcomes. Could we create a separate program, continue, if we put it on the ballot, I think we'll continue to pay for health care for people who are uninsured in the jail, and but could we use some of the fund balance to create a pool of money where we could create a request for proposal system with criteria around providers that could apply for the money based on specs, RFP, that would say it's got to be for the uninsured, because that's consistent with the millage language. But on top of that, a proposal to improve their health outcomes. Because right now, I think that this was principally put in place so that people wouldn't go into medical debt, and that they could get care on a consistent basis without going to the emergency room or the free medical clinic. So I think originally when this was conceived, it wasn't really designed, I don't think, to necessarily improve health outcomes in a macro level, certainly for individuals, I guess. But we could use some of that money to drive innovation and drive health outcomes through an RFP process. I don't know if we have the capacity in the health department or somewhere else in the county to manage something like that, but it would be interesting to see what providers out there would propose in terms of how to address the issues that we've all talked about in a more innovative, creative way by offering some incentives that way. So I just wanted to offer that. Mr. Flewelling.
Thank you, Mr. Chair. Just to touch on that for a moment, my fear with that would be if we have a pool of government money sitting there and we look for healthcare providers to offer service. If you look at health, the way I look at healthcare personally, if there was no health insurance at all and I went to the doctor, they're going to bill me what I can afford to pay. With the private insurance, they're basically going to bill what the private insurance will pay. With a completely sole provider, government-funded option, they're going to charge you whatever the government's going to pay. So while we may get RFPs, I think the bar will be set with the fact that Marty Kuzno's not paying that bill. Genesee County is. So that would be one of my fears there. But I wanted to touch real quick on the numbers that Josh provided earlier. We got $7 million for GHP, right? $5.5 million for the jail, and $2 million for the hospitals. So $14.5 million, we're already deficit spending, even if we renewed this at the full 0.988, right? So the hospital part, we'll have to talk about that later. That kind of blows my mind. They're making plenty of money, in my opinion.
They negotiate all the time. You're exactly dead on.
Yeah, I can't go to U of M anymore because I got Blue Cross, so, But I guess that's, we need to look at all this, I think, because because that 13, correct me if I'm wrong, but that 13,094,771, don't we lose 450,000 of that to DDAs? Or is that, did I not read that all the way through? Is that an exemption?
No, they, in those districts.
They capture that.
Yeah, they capture that amount.
Okay, so our full levy's closer to 12 and a half, somewhere in there.
I can verify, but.
Okay, so we're already $2 million in the hole. I love Marty's plan with fund balance, but if we continue with these numbers the next 5 years, that $10 million gone just based on what we have right now.
Yeah, we just stick a number in for the hospitals. Ultimately, you guys have to approve that.
Right. No,
So
I
we
get
just
it.
Put that, yeah.
Sure, no, I get it. I do, if I may, Mr. Chair, I have a question for
course.
Crystal.
Yeah.
I don't know if she can answer it, but. Thank you. So, in talking with some people at the Sheriff's Office, my understanding is that some of the people that we provide health care to at the jail may have the means to actually pay for it, but we don't pursue that through some type of process. Does that make sense to you? It may be on GHP, they may have Medicare, Medicaid, it gets dropped and they go into jail. But they may actually have the financial means to pay for that care, but they're not.
Okay.
Now, is that a controller issue? Is that something that your office would look at, the sheriff's office would look at? I'm just wondering, if we can save a couple $1 million a year by making people pay for their own health care.
See if, we could meet and discuss how we would move forward with that. I don't know how, there'd
I
be some
can
work to
s- I
figure
can
out
speak a
who
little
could
bit
pay
to it.
for it.
Okay.
Yeah, we could.
They, in the past, have decided that they were not going to bill for that.
Okay.
So they could go in when somebody puts money in their commissary and use that for care, those types of things.
Yeah.
But that's a policy decision that the sheriff would need to
Okay.
address.
I just think maybe it'd be worth having a conversation with them to say, look, you generate a bill while they're incarcerated.
100%.
And if obviously you don't want to slow down out processing to get them out of there, but through the course of that invoice, if they show they don't have private insurance and they don't have the means to pay for it, that's something else. But if there's a guy, I know a couple guys been in there making a couple $100,000 a year, there's no need for any of us to be paying for it. So maybe that's a conversation we need to have with them to try to build some kind of process to ensure that we're not
Yeah, we could do that.
giving a millionaire with a drug problem free health care while he's in the jail.
We had those discussions early on, not with this board, but previous boards.
Sure, okay.
But yeah, for sure, we could put that on the list.
And the time might be ripe for that with the other situation with the meals.
Absolutely,
How else can they tighten their belt?
yeah.
I agree with that 100%, because, you know, if a person gets arrested for drunk driving and they have insulin at home, they don't have it with them, but they have already purchased that insulin through their health care plan, then the county shouldn't be paying for that. So that's absolutely something we need to really have a conversation about. I also agree with Commissioner Cousineau's suggestion that we need to, I don't know if the word is not compensate, but we need to course correct the millage, because we've kind of collected too much, it sounds like, because we have this fund balance. So in order to course correct, let's levy less so that we can use up some of that savings that we've already accumulated, and give the taxpayers a break, a temporary break. But what if that temporary break was viewed as an incentive for the public to get healthier? So in other words, knowing that this break is going to take place for a year or 2 years, whenever we pay it down, but let the public know that this levy amount will go up again to the regular amount unless we challenge the public to get healthier. For example, we know that the dental program is one of the biggest price tags for everything. We need to if we could just get a handle on the dental program, that could save a chunk of money. And how do you do that? By getting people to be proactive with their dental care, by going in to see the dentist twice a year. One of the things I talked to Jim and his team with earlier this week was about the free clinic. And this is the other thing that we need to really keep in mind, is that Genesee County is kind of in a sweet spot. I know Commissioner Getzinger asked the question a while back, are we stupid or are we just a leader in this because we have a health millage? Well, in listening to people, I think Genesee County has done what Genesee County needed to do, because one size doesn't fit all. And one of the reasons why we're not like Wayne County, we're not like Oakland County, is because of this free clinic element. Let me just use that as an example. I talked to Dr. Fortunate about the free clinic. She manages the free clinic program. And I asked her about capacity. And she talked about how all of these volunteers are working their tails off. We are very lucky in Genesee County to have the volunteers to help with dental care and help with, all of these other ailments that people have. But the volunteers get burned out, and we don't have as many volunteers as we used to have. We're not like Wayne County, because Wayne County has a much bigger pool of volunteers to be able to take care of their population, when Genesee County has a smaller population of volunteers to take care of the folks that we need to take care of. So, and then I asked her about a waiting list. She said that there's always a waiting list for the free clinics. We're really lucky to have Hamilton Healthcare in our community, and I know they just expanded, but my guess is that they're at capacity too, and they could always use more help. The other challenge that's facing us, and I gathered this from talking to Dr. Jen, I can't remember her last name, but EJ? Dr. Edwards Johnson, yes. She said that, you know, we're really in danger of losing a lot of doctors in our community. And, you know, she has a training program at Michigan State University where she's training young interns. And so she talked about a perfect storm happening in this healthcare space. And so the perfect storm is the health outcomes that are not improving, and the number of doctors, qualified healthcare people that are disappearing, and I think the rising costs of care, and the shrinking pool of the stress on the volunteers. So there are a number of factors that are swirling around that are creating this perfect storm. So what are the solutions? The first thing that, I'm connecting the dot too with what Commissioner Wayhill talked about earlier, about us looking at the big picture and looking at long-term solutions rather than just trying to figure out how to fix this now and how to put out this fire now. We really have to be more intentional about addressing the top 2 ailments that impact our population the worst. You all know it, you've heard it from people over the last month or so. We know the top 2 ailments are hypertension and diabetes. If we can get a handle, that's the upstream baby. Hypertension and diabetes. If we can get something going that is very intentional and very robust about solving that hypertension and diabetes problem, in addition to the dental, preventative care, then I think we can kind of come to a long-term solution to get ahead of this perfect storm that's happening right now. So the solution, again, I think to give a little bit of relief to taxpayers is to, pay down the fund balance that's there now. The other thing that I heard Jim say is that there used to be a meeting every June between the health officer, the health department, and the CFO to reflect on the millage, to look at the reimbursement and all of that stuff, and then so we could make sure that we stay on course. In other words, trying to manage that millage as you go along. So I like to see those meetings reinstated so that that conversation happens in an intentional way. And I think that, giving the public a mandate, if you will, to say that we as a policy board, we will, give you a break on this levy, a temporary break, but we're also going to challenge you as a John Q. public to get healthier. And if you don't get healthier, then guess what? We're going to have to, look at this millage and levy it back up to the full amount. I'm just kind of thinking out loud about long-term solutions, getting to that upstream problem, and managing it along the way, so that we can, this is a big animal to wrestle with, because healthcare is just so chaotic in this country. The pharmacists, we're low on pharmacists, qualified pharmacy people too. It's so out of hand, but we have to be creative. And that's why I give Genesee County credit for being creative with creating this millage, because the alternatives are the health department, the Hamilton Family Health Care, and the free clinics. But all 3 of those systems are stressed and maxed. So we're very lucky to live in, listen, neighboring counties. if you're living in other counties, this is a good reason to come to Genesee County, because guess what? We have this healthcare millage. That's one of the things that sets us apart, right? So keep that in mind, advanced manufacturers, when you come to Genesee County. Keep that in mind when we design this sports commission and we're bringing in more people into Genesee County. The healthcare millage is an asset that we have that sets Genesee County apart from everyone else. And it's a part of the bigger formula that I think will help with our economic development bottom line. Thank you, Mr. Chair.
You're welcome. Mr. Getzinger.
And to take a little more from Dr. Brown, if I remember correctly, in our couple of meetings, we had talked about the shortage of doctors for the free clinic, and there were some ideas of like incentivizing like student loans and some things like that to help get more people. I know the more you pay them, the less it's really called volunteering, but that was one of the solutions. So I think you give this group a time over the next couple of years, do some of the things we're talking about. 'Cause like I said, everybody was really looking at, you know, innovative ways to save money and still keep some results. And I think another result we should look for is what would we look like if we didn't have it? You're saying we're the worst now. What if we didn't have it? We'd really be the worst, probably, you know. And then the other thing, my only thought of moving forward, and I agree, we probably need Del Rico here, but there is a millage campaign that's going to have to take place by people, and so we want to be able to give everybody time enough to get out and advertise this millage as well.
Thank you, Gary. I saw Commissioner Cousineau's hand.
Yeah, Jim, you don't have to stand up, but what is the number one, well, you don't have to come up. What is the number one cause of the two chronic diseases that Dr. Brown mentioned? Hypertension and diabetes. What's the cause of that, the number one cause?
Oh, I think poor eating, diet, lack of exercise, I think access.
Weight.
What's that?
Weight, which all that leads up to
Yeah,
weight.
absolutely, but lack of resources, especially.
Self-care.
Well, self-care. And also lacking those resources in their communities, grocery stores and other areas, especially in the city of Flint.
Okay, thank you.
Jim, go ahead, Dr. Brown.
I was
Would-
just
Would
gonna
you
say-
stay for, go ahead.
What you just stated fell into the category of social determinants of health.
Absolutely.
So that's kind of what I had in the back of my mind, because if we address those social determinants of health, then we can help fix this hypertension and diabetes problem. But right now, we're not giving it the attention that it deserves.
Jim, I had a couple questions that I'm hoping you can answer, at least get us answers to. Of the current membership or participants on BHP, do you have a sense of what percentage have serious chronic conditions? And I may not even be saying that right, but I'm trying to get at the most unhealthy folks. What does your population look like in that regard?
Well, in 2025, we had, and that was, I think, it's an answer to one of those questions in the packet.
Yeah.
We had 1,200 folks that were diagnosed with hypertension and 431 with diabetes.
Okay. And those
Over
are,
half of
yeah, so over half have what you would consider
chronic, and there's others as well.
chronic conditions that, if left untreated, could produce stroke or other, medical issues that would be quite costly.
We have high asthma here in Genesee County, probably because of the environmental issues that take place over time.
Okay. Other discussion on this topic, Mr. Shoemaker?
Thank you. We discussed the fact that we cut checks to the hospitals, and that is, to clarify, to cover uninsured, uncompensated care. So we have our policy that we can come up with, there's the Affordable Care Act. Why should they be having this number of people come through that we're cutting a couple $1 million in checks? You know, because I think it's, Josh, it was $2 million we discussed before? Is that right around where we were last year?
number has varied.
Up or down?
Year to year.
And we're
Just
required to
depends on
cut
what we have.
some, but I
Yeah.
think it's $100,000 or
Yeah.
something like that per hospital.
Yeah, 2 million is what's included in the budget.
Yeah, so my question to this board is, you know, one, if we have that many people going through that it justifies $2 million to be spent with these hospitals, then we need to have a better way of making sure these patients get signed up for Genesee Health Plan or something. There needs to be a better mechanism. I've mentioned this before years ago. This is something that needs to take place. And then on top of it, if we're giving the hospital these checks and this money, are they waiving their collection process to anyone? And if you don't understand what I'm saying by that, is let's say we've got, let's say Bill Bradley goes in, and guess what? Bill Bradley and 10 other people like Bill Bradley, Sarah Smith, or whatever, all go in. Are they just taking the check, and we're paying them to take care of someone who can't pay their bill, but yet they're still billing those individuals or going after them for collection? So I think there needs to be something they're showing that, hey, guess what, we're not, an example, if they have someone that, guess what, we know will never be able to pay that bill or have that competency, why should they just get all the benefit of they're gonna write off the loss and we just gave them a check? You know, because I'll bet you they don't, there's not a single invoice that doesn't continue on after we cut them those checks. So I'd like to see two things, especially if this board moves forward with this. Is one, I'd like to work, if we're gonna work with Genesee Health Plan, I'd like to figure out a way to make sure they're there working with the hospitals to make sure, guess what, we're catching all and capturing all these people. So we don't have to cut this big a check. And two, I'd like to look at the number we cut these hospitals, because some of their executives, their salaries they're up there. You know, so, and I wanna see if we could, and I don't know, Josh, if it's you that deals with that, or Crystal that deals with that, I'd like to know if they're actually erasing someone's invoice for this, or they're still billing everybody the same, and we just are cutting them a check to cover that, so their bottom line gets better. So, I'd appreciate that if we could look at, if we could look at that, that'd be great.
That's a great point, because if we're giving millions of dollars for uncompensated care, they should be writing some of that off from people who, as you say, you know, you can assess someone's situation and know that they'll probably never be able to pay it, or at least most of it.
What I bet is happening is we're cutting the check, and they're taking, after a period of time, they know the individual's not gonna pay, and they're gonna write it off. So they're getting a tax break and, you know, and collecting our money. So, thank you, Mr. Chair.
You're welcome. Jim, you're getting your steps in. Would you approach again? I wanted to, Mr. Shoemaker made me think of this question, which is, even though we have GHP, I think we know that there are uninsured people still. What are, in your mind, you've been at this a long time, what are the major barriers for people to sign up with you? And related to that, this topic is the Health Coalition. We did give them, was it $1 million or 500,000? 500? A couple months ago, Mr. Antonet came and presented, and as I recall, that proposal was designed with these dollars, right? It's millage dollars to, not using the right terminology, but the frequent flyers at the emergency rooms. I think the Health Coalition has a plan to with our dollars to try to mitigate their visits and maybe direct them more towards you all. So wanted to mention that we did approve that. Can you talk about barriers to people signing up with you, or just knowing about your offerings?
Well, I think that's part of the issue. Is that sometimes they're not familiar with what we do. A lot of times people get newly uninsured. They find themselves, their employer's no longer offering the insurance, or they turn 26 and they're off their parents' insurance. They lost the job. They were working 2 or 3 jobs, And so I think it's just a matter of them knowing that there is this resource available, and we do. We put ads out. We've done a lot of, but we don't spend a ton of money of these dollars. We get 20% admin that we include in the marketing or advertising, but there certainly could be more outreach that could be done. But our staff is out there. We do 70 or 80 events a year, everyone that's out there, and so we do. But certainly there's more to be done. That's for sure.
I'll compliment Shannon, who joined me at the Swartz Creek Senior Center for one of my lunches that I do quarterly at my 3 senior centers, and she did exactly what you've just described as great outreach to the seniors to let them know for themselves or others how they could, take advantage of what you offer.
Can I address
Of course.
Mr. Shoemaker's?
Sure.
The hospital. So we do not, the health plan does not cover inpatient care or emergency room. And so people are going to go there, whether they're unsure there are members, they're going to go to those places. Hurley does, all the hospitals have staff there that will then either try to enroll them into Medicaid to pay for those bills that are there, or they'll refer them to us to cover them on their outpatient after they leave the hospital. So there are mechanisms that are in place. I don't know your answer, whether uncompensated care, I can't remember, Dr. Brown, what Keith Ponier said. It was $30–40 million between the 3 hospitals. And so the $2 million is just a fraction of that uncompensated care in our community.
In 2025, it was 42.6
Okay,
million.
thank you, Josh.
Mr. Shoemaker?
Here's just a question. So we're selling them a plan that doesn't cover catastrophic visits? You're saying it's not, emergency room visits aren't
Yeah,
covered?
we're not insurance, so we can't cover those things.
So we're just covering for them with the $7 million, just basically like primary care.
Primary care, specialty care, medications.
What do you think, what do you spend per patient? What do you think you spend annually per patient then?
I gave that at the last meeting.
I know you did, I just can't
I
remember
did.
what
It was like $198 a month, or like $2,000 a year.
No, I appreciate it. It's just such a big issue in our nation, and we still haven't found a solution, because we keep asking the same people who caused the problem to friggin' fix it.
I would love to sit down with you and go over a lot of your questions.
So, no, but I appreciate you bringing that up, because I did not know that, so thank you for informing me of that.
Okay.
I
But
appreciate
I'd
it.
love to go over all that with you.
Yep, so, thank you.
Yeah, yeah. Do I need any more steps?
I think I'm good for the moment.
Counter, I don't know.
I do need more steps.
Let's do a time check. So we're at 7:45.
And
Good.
just,
Go ahead.
this village ends November 30th.
Okay,
Our agreement ends with the county September 30th.
okay.
So we don't have this on the ballot, or we don't, I feel some urgency. I don't want to try to put pressure on all of you, but there is an urgency to continue to do business for us, so.
What, Josh?
This levies again. This is the last year it levies. It levies for the December tax this year,
Yeah,
according to the ballot. Is that right, Melissa, or no? Yep. It levies one more time.
okay.
No.
We do these workshops so we can really delve into things in a more thoughtful way, and, taking it off of several dozen resolutions at a regular meeting or committees. And I think we've had that discussion tonight. The question before us, so there's a practical thing where we did postpone the original resolution we have before you on paper. It doesn't have the number on it, but we did postpone it to one meeting, and now we postponed it to, is it on there? Oh, it is, oh, sorry. The number is on there. So postponed twice. I think, I was asking Brian earlier, if we don't choose to act on this tonight, it looks like Mr. Winfrey is now gone as well. Do we want to, I think we would need to postpone it probably to a committee meeting or a full commission meeting? Is that your recommendation?
That would be the cleanest way, yes, that's what I would recommend. You can postpone it to a date certain, a certain meeting, or you can postpone it indefinitely, and it gets brought back whenever somebody wants to put it on an agenda.
All right, Commissioner Shoemaker.
I think to avoid future conversation, I think there's an appetite to actually cut the millage on this board, so I would like to see, when it does come forward, the rate collected, adjusted, and obviously we know what we have in the fund, we know what we spend, and so I can't speak for everybody, but I'd like to see that if that's a
So
possibility.
I know there was a suggestion by Mr. Cousineau for an exact amount, I think, in terms of what the rate might be. Is that, did I hear you right?
Yeah.
Maybe 0.8?
Off the top of my head, that's what I came up with.
Yeah. Okay. Mr. Fly?
My only thought would be that might help with your hospital negotiations too. If you do 0.8 and you know you got 12 million going out, they can only get what we got.
I don't think there's been a lot of negotiation.
And
Probably not.
I like the direction that was laid out from the committee that's met twice, that Mr. Freeman laid out. I think that is a
5 years and,
good direction to, yeah, make sense to
yeah.
do all those
And
things.
really keep a closer eye on it. I mean, this isn't the only millage that, I think the county adopts millages that, I should say, the voters do. We put them on the ballot for years, and I think they do good things. Clearly there have been good things done. I use the senior center, or the senior services millage as an example, where we don't, I think previous commissions may not have had a mechanism in place just to see how's it going, what are the outcomes, is it effective? So instead of just putting millages right back on the ballot, I think we're exercising, some of that due diligence where we can decide whether it's working or not, and if it's not, how can we tweak it, and if we can't tweak it, maybe we don't do it. Thank you, Mr. Shoemaker, for that suggestion. I will, I guess, talk with Mr. Freeman about modifying this resolution consistent with what I think is a rough consensus here. And so we'll want a motion to postpone. Should it be to a full commission meeting?
I'll make a motion to postpone indefinitely.
I don't think we have to, it's just discussion item. No action should be needed.
Just put it back on? Back on the full commission meeting? Oh, on the committee.
Yeah, once we
Okay.
you have everything worked out.
So that meets 3 weeks from today? Is that right?
June something, June
Yeah,
10th?
June 10th, so it is 3 weeks. Okay, so
I
we'll,
was just going off the parliamentarian's
I
recommendation.
appreciate that. Well, without objection, we will ask that this item come with a slightly modified resolution to our June 10th Health and Human Services Committee meeting. Mr. Shoemaker?
To Corporation Council, do we need to postpone it because it's a discussion item? Is that what you feel? Because I want to make sure we're following the rules, but I always thought discussion item was just for discussion. There was no action to be taken. We'd had to put a motion on the floor to accept to actually move it to something to vote
yeah.
on and then to vote on.
So it's listed as a discussion item, but technically it was a resolution that was postponed to this meeting, which is why I think Brian said what he said.
And that's how it was presented to me by the chair on a sidebar here. So just to be as clean as possible, I think there should be a motion to postpone it to a certain meeting, or indefinitely, or without objection. It can just be kind of just let die.
What,
Postpone it to the next board meeting.
Mr. Flewelling, if you would make your motion, I think you tried to put it at the committee at June 10th?
Well, I said indefinitely, but if you want June 10th, that's fine by me.
Oh. Postponing it to then will allow us to take it up again and decide whether there's,
Right. Indefinitely, you could just take it up whenever
oh, I
it's
see,
prepared,
I
but
see.
I like a definitive date.
I will draw my motion.
All right, someone make a motion, please.
I'll make the motion to bring it up at the next full board meeting.
Full board meeting. All right, we'll bypass the committee. Is there a second?
I support.
Just for clarification, I believe there's a board meeting workshop for June 3rd. You don't mean that one, do you?
The full board meeting.
That would be the 17th of June, I think. Is that right?
Yeah, it'd be
June 17th, the first regular
board meeting.
full meeting.
'Cause
All right, so,
substitutes as a committee meeting.
motion to postpone to June 17th, the first full commission meeting after tonight. All those in favor say aye.
Aye.
Any opposed? The motion is carried. Thank you all. Was that a huge sigh? Oh, Mr. Freeman is not feeling well tonight. I know that. Other people have allergies. I know we got cough. So we do have at least one other item. I think we can, this routing and tracking piece we can take up later, but I talked with Commissioner Shoemaker last week. We did have a couple motions related to an inquiry with the Road Commission. A series of questions were submitted to the Road Commission. They responded to those. I believe everyone has copies in their email. And, you know, really the only way we can decide how to move forward, or if we want to move forward in different ways, is to have a discussion with the full body. So, Mr. Shoemaker, I'll defer to you.
Thank you, Mr. Chair. After we received the letter, I'd ask, make sure that we met the chair, Corporation Counsel, and Mr. Freeman. We're just trying to get next steps on what this body would like to do to move forward. There are options. We could actually ask them, request them to come over and have conversation. I think, in my opinion, they've answered most of the questions that we had out there satisfactory. But if someone had a difference of opinion, we need to hear that now. But also, we need to talk about next steps. If this is far enough what you guys want to go forward with, or if we want to move in a different direction with the Road Commission, this is the time. I just wanted to have the conversation move forward. If you feel it's going to be a longer conversation than that, we can always bring it up later, but I just want to get everyone's point of view before we stall it a little bit or we accelerate it moving forward, because I don't think it's fair to keep those lines of communication open with what we've been trying to do. So, thank you, Mr. Chair.
You're welcome. So the other piece that I'll mention explicitly, and I think you were getting at it, is in addition to the inquiry into a vote that they took, we also passed a resolution that requested from Corporation Counsel a memorandum about, you know, options with the Road Commission that might be look differently than the way it's constituted today. And he supplied that at least a month ago, maybe a little bit longer. It's in our email. So that's the other topic that I think you're referencing.
I was going to do this one and then. But
Yeah, okay. I'll open the floor to discuss the topic of the Road Commission. Dr. Brown.
I will be totally honest with you that I have had so many other things going on, I didn't pay attention to that. So I am not prepared to have a discussion about it.
Additional conversation and workshop setting. I'm sorry, Mr. Flewelling. Thank you, Mr. Freeman, for...
To follow up on an email from you, Brian, is not an answer I need tonight, but with those options that you presented legally, can you look for me, may just be my opinion, and that's fine, if legally, if we were to move forward with that, would we be able to bring it down here as a transportation department, let's say a transportation department with a director that answers directly to the Board of Commissioners? Does that make sense to you? So it's kind of separate but equal?
Yeah. If you're talking about the Road Commission
Yeah.
being part of the county, it would answer to this board.
Directly. Yeah, nothing against county administration, but to kind of cut a layer out, so it comes straight to us, runs through Public Works, which it kind of does now, and it just answers to those non-members and.
Yeah,
we
it
give
could,
direction.
this board could set it up that way, yes.
Okay.
And I think it would really be the function of the Road Commission, not the commission itself, that would come down here.
Right.
A department, as you stated.
Operationally.
Yeah.
Right, yeah.
Yeah, basically, you're just cutting out the 5.
Yeah. Yep.
Additional discussion on this topic. So, all right. I don't have anything to say at the moment, I guess. Anyone else? Mr. Shoemaker?
If no one has anything, I would just like to say, let's let everybody have some time to marinate on this. I don't think we should bring it up in June, but I think the next workshop we have after that, it's a good time for a conversation again to approach it.
Yeah, I mean, I will say, and I said this to Commissioner Cousineau, I think last year, when there was some discussion about, you know, formats for the road commission, and, you know, I like to think I'm always open to new ideas and at least hearing things that make me think differently about how we might be doing business as a county. Whether I end up supporting it in the end, I'm certainly willing to study it and think about it. And I think at that time we got a copy of a study, a case study. Was it Calhoun County or was it and Ingham? Okay, yeah. So there are a couple counties that have chosen to do it that way, and we have that information if we want to look at it more closely along the lines of what Mr. Shoemaker's saying. Mr. Getzinger.
As I read through the responses and all that, it seemed like they had lots of money to do what they wanted to do, and so I'm just curious. All I know really is what I read in that response. So what's your take on their response, just off the cuff?
For full transparency, I received a call from the director when the letter was received. And we discussed several things. You know, their belief is they have enough funding in their retiree health care plans and other stuff to do this. As you know, there's several of us, though, that feel, guess what? Just because you overfunded that doesn't mean you're managing things correctly. Now, he's only taken over, to be fair to him, less than 2 years ago. So those funds have been being put in there for quite a while. Now, and obviously we know you can only spend those funds on what you've labeled them for. But the problem is our residents, you drive the roads, you go around, especially if you're in the townships and you're seeing the immense work that needs to be done, those funds, you shouldn't have overfunded that account. And I feel they've answered those credibly, as far as from what their duties are. But does it mean that, guess what, I'm satisfied that they should have done it, or the way they've been allocating those funds? No. Because everywhere else in government, other than the federal level where they can just keep printing money, there are tough choices that have to be made. Employees aren't getting lifetime health benefits. Employees aren't getting pensions. Where our staff here, I mean, they're worried every time we got to take up a union contract, you know. And if the roads were tip-top, perfect shape, you know, and I didn't feel my fillings rattle on a couple of them out near me, I might feel completely different. And not that they're not doing a good job as far as our staff who does the roads and the people who do the work, but it's the fact is those funds, those additional millions of dollars could have went into doing some roads, which is part of our priorities is economic development, and part of economic development is good infrastructure. And that's why this is so important, and I think we still need to visit this further, because there's also been other conversations over the years, not dealing with this letter, but as far as funding mechanisms that were available at the state level that would have fit our economic development plan or our planning department's plan, and they've passed on those. So these are conversations we need to have, because we all need to be rowing in the same direction. Because if we're not, we're going to go in circles, and guess what? The county's going to be in a worse position than it was. So, but as far as the initial letter, that was my reasoning for it. I explained it very clearly. Is guess what? Just because the funds were there, they shouldn't have been there in the first place. So, the road should have gotten done. So that's kind of where we are. If that answers your question.
Mr. Flan.
Thank you, Mr. Chair. So I will just say this. Commissioner Cousineau and I talked about this quite a bit last year, and I wasn't quite seeing what he was saying, but I would encourage everybody on this board to read the meeting minutes from the Road Commission. They spend an inordinate amount of time talking about anything but the roads. There are topics that are discussed at that meeting that have absolutely nothing to do with our township roads. And for me, when I read that and I see where some of their individual focus, attention, or agendas are, that's what causes me great concern. You know, when I get a call from my niece that she replaced all 4 shocks on her car going down Oak Road, which is one of the, not a main road or a major road, but it's a fairly major road, running through Davison Township and Richfield Township, Forest Township, right? And so I would just encourage, and I think everybody on the board gets them, read their minutes, see what their commissioner concerns are at each meeting. And a lot of times it's anything but roads. So, thank you.
I think we just got a set of their minutes yesterday, or today, right? Yeah, we get those regularly. Additional discussion, so it sounds like there's consensus that we will come back to this topic in a couple months, a month and a half or so, but not on June 3rd, so that we can give it more attention. I think we'll skip our referral and routing. Does anyone have anything for the good of the order? Mr. Floyd?
Thank you, Mr. Chair. I do have one thing I want to say. Being one of the 2 newest members on the board, I've been impressed for the last year and a half at the standard that everybody here holds themselves to as far as decorum and professionalism. That being said, I would encourage strongly our members of the audience, including our staff and co-electeds and general public, to exercise that same standard. I was a bit disturbed last week. There was a lot of chirping going on in the audience, mostly directed at 2 members of this body. And I would just encourage everyone that attends our meetings to perhaps use the same standard that I've always taught my kids and my employees. You don't say anything in a crowd or in a crowded room that you wouldn't say to somebody's face. If you're going to say it in a crowd, or you're going to say it on social media, you say it directly to their face. We're here to do a job. That job gets a little bit tougher when there's audience members saying things and having opinions they probably shouldn't. So I would encourage audience, general public, staff, and co-electeds to exercise a higher level of decorum. Thank you.
You're welcome. So I would, if that happens again on any item, I'm not great at hearing. My ears are going. Those of you that can hear it, and if it's disruptive, like last week I did hear the graduation downstairs, but I couldn't hear anything from the audience. So bring that up in the moment if you can hear it.
I would say even if it's not disruptive, have some class.
Yeah.
We can have differing opinions.
Yeah, absolutely.
That's what America was built on.
Yeah.
Thank you.
Yep. I just bring it to my attention so I can, tell people to behave. All right. We are adjourned at 8:05